The lack of economic resources needed for healthcare expenses is due to the poor influences of the physical and social environment and the social and economic resources of households. While individuals deprived under impoverished areas seek to improve their circumstances, barriers in educational attainment, employment for higher income jobs, and social mobility limit the opportunity of disadvantaged people to improve their circumstances. Thrust into the cycle of multi-generational poverty, this thereby makes it more difficult for these individuals to achieve higher socioeconomic status and economic resources. As affected groups belong to poor communities, they are hence unattractive to businesses and housing. This weakens the public schools of the area, further exacerbated by poor infrastructure and funding of their community. This all ties into poor funding of healthcare facilities in the area and greater likelihood to not have accessible health insurance in order to receive their care. In addition, the influence of mass media worsens the consequences for these communities through their impact in the decision-making process of public policy. By inducing healthcare into an area of contest for political control, mass media companies develop messaging efforts to create powerful implications to shape the way in which citizens view healthcare while remaining vague on marginal benefits. Due to the commercial interests, they shape the healthcare industries into targeting the research and development and marketing efforts towards the most profitable opportunities. Notwithstanding their practices, they defend their self-interest to protect their own concerns. Even with the expensive hospital costs of the US, there are still greater expenses in the industry to medical research and R&D. Medical research in America alone costs much higher than other countries, and there's a high demand for healthcare services. This also contributes to the increase in healthcare costs, as demand must be met among a higher population. If medical research costs exceed its budget, hospitals and insurance providers then have the ability to raise prices due to higher demand for the healthcare services they provide. Additionally, an aging population in the United States requires more hospitalization, and it increases the demand for intervention from governmental healthcare insurance services like Medicare. The number of individuals who have a type of chronic disease is also very high compared to other nations. Because of this high demand for hospitalization and healthcare services, US hospital prices are 60% higher than those in nations in Europe. Certainly, the poor health of many older Americans will not alleviate the burden on our healthcare system. Next, we will focus on consequences that result from the causal factors of healthcare unaffordability.